The need to address tobacco use remains critical, and the problem is pressing in undeveloped and developing countries. Although every cigarette contains a low amount of a carcinogen, many carcinogens, there is a cumulative effect of multiple smoking of many cigarettes every day. Nicotine itself is not considered a carcinogen. However, it does reduce apoptosis, which is the process by which cells which have issues, problems, self-destruct. And they also increase angiogenesis, which is providing more blood flow to a possible tumor or cancer. And so nicotine is not good. Next, it's important that passive smokers also, they're in danger. People should avoid tobacco and nicotine, even secondhand smoke. Smoke can be covered in surfaces, and even smokeless devices are not safe. Many smokeless devices have been found to be also carrying other carcinogens. And like I said, passive smoking, by living with a smoker, the risk of lung cancer increases by 20 to 30%. So health professionals should discuss and offer tobacco cessation medication and assistance or referral. All right, so here's the thing. You need to ask every patient about use, advise every user to cease, assess willingness to do so, and provide assistance. When there is willingness, arrange for support within 1 week. And that should help. Okay, we're going to talk a little bit more about the team involved, but I would like to just briefly mention the importance of pharmacotherapy and behavioral support. All right, so there are several modes of pharmacotherapy. There's varenicline, also called Champix. Nicotine replacement therapy, there's the patch, gum, lozenge, and bupropion. All right? These are the ones that are authorized. So the e-cigarettes, they are not generally considered to be helpful. It's possible that they may even adversely affect people's health because it encourages continued use. It facilitates smoking in places, for example, where tobacco cigarettes are not allowed. And so people might be vaping indoors around children more often because it's convenient and they feel that it's not dangerous. It can cause the younger generation to become more addicted as well if it becomes popular. I must say, however, that the FDA has approved Vusolo ENDS. So this one particular brand has been approved by FDA as a possible means for people to help quitting their habit of smoking. All right, but it is important to note behavioral support is also vital. Again, like I said, I'm going to mention a little bit more later about the importance of team. But yeah, self-help materials have been found to be making a difference. They increase quit rates compared with no intervention. Next, individual counseling is more effective. And the more intensive that counseling, the more effective. And so when there is counseling, not just the pharmacotherapy, but counseling, those two things together combined would increase someone's ability to quit. It's just not easy to quit. Nicotine is an addictive drug, addictive substance. Health professionals should identify exposures, educate about how to avoid and mitigate chemical carcinogens. So I mentioned about asbestos insulation. The good news is that when the insulation is well installed, the asbestos is not such a big deal. But the problem is that people inhale a lot of air, 10,000 liters. We inhale 10,000 liters of air every day. And so even if there's a bit of carcinogen in the air, that's going to negatively affect our health. And that includes smoke in the air. In the home, it's particularly poor if there's coal being used inside, all right? In Shenyang, China, those who lived in the somewhat or slightly smoky parts of the city, they experienced 50% more increase in lung cancer. All right, so somewhat smoky was 50% increase in lung cancer smoky areas, 200% increase in lung cancer. And fossil fuel combustion releases some isotopes of lead, radium, thorium, uranium. We're going to talk about the physical carcinogens coming up. But the point is that that smoke has some carcinogens. All right, it's not simply the CO2. Indoor burning of coal, for example, it doubles lung cancer risk. And the effect is more pronounced on those who are spending time in the kitchen, like I said. So these kind of facts and details were shared by Samet in 2018. On to, okay, diesel. Diesel is particularly bad, carcinogenic. Diesel exhaust, paint fumes, welding fumes, tar. Okay, these are all carcinogens, well-known carcinogens. Next, beware of chlorinated compounds at home and in the workplace, wherever there's exposure. Even people found through research, epidemiological research studies in different places, they found more contact with chlorine in water. For example, chlorinated showers has increased the rate of cancer. Okay, and be careful of exposure to pesticides and chemicals. So an example of industrial chemical, rubber, in the production of rubber, in the production of pigments, colors, dyes. These can all affect the bladder. They're related with bladder cancer.